Good afternoon, everyone. I'm Dr. Ravneet. I'm a consultant in medical genetics in Motherhood Chaitanya Hospital, Chandigarh. So, I'll be discussing in brief the genetic aspects of cancer and the importance of genetic testing in cancer. So, cancer is basically just a condition where the cells keep on growing unconditionally and uncontrollably, and then they form a tumor, and these tumors can slowly spread to the adjacent areas and also to the other parts of the body via the bloodstream or via the lymph. So these cancers are caused by a gene change. What is this gene change? So we have genes which control the age of the cells, and whenever there occurs a change in this gene, this can lead to the uncontrolled growth of the cell, and this cell can then keeps on dividing and then keeps on growing and then keeps on dividing and then forms a cancer. So these cancers, this gene change is caused by many types of factors. So mostly are environmental, like some viral infections or some radiation or some chemicals, some toxins. But then some of the gene changes can be present at birth of the baby, which are hereditary. Hereditary means which are inherited from the parent. So all the cancers are genetic, but only some are hereditary, which means which are inherited from the parents or which can be passed on to the next generation. So around 5% of all the cancers are hereditary. So there are many types of hereditary cancers, like the most common is a breast cancer, ovarian cancer. Then there are some colon cancers. Colon cancer means there's a cancer of intestine. Then a few types of gastric cancers and some types of brain cancers, brain tumors, or some types of blood cancers are also hereditary. So why do we need a genetic testing to be done in the cancers? Because if the cancer is genetic, if the cancer is hereditary, so then there is a risk that this cancer would be present in other family members, the first degree relatives of the person, or it could be passed on to the next generation, that is their children, or there's a risk that his or her parents can also develop this cancer. So we always need to go for a genetic testing for these types of cancer, which we suspect are hereditary. So these cancers, they differ slightly from the environmental cancers in the way that they are refractory to the treatment. They usually do not respond to the usual treatment. They can keep on relapsing, and then the person can also develop different types of cancers. Like if a person has a breast cancer, she can also develop some ovarian cancer, or the male siblings, if they have the same type of gene mutation, they can present with prostate cancer. So we always need to go for a genetic testing for these cancers. The genetic testing is a very simple blood test. So we take just 5 ml of blood, like normal blood testing, and then we test for all the genes which can cause cancer. So if we know that now this person has a gene change that can cause a cancer, we need to go for, so the result can be either positive or a negative test. So if the person is negative, so we know that the person does not have the risk for developing that type of cancer. But if the person has this positive test, so we know that this person can later on develop a cancer. There's a risk that this person can develop cancer, so we need to start the screening for these types of cancer. For example, if a person has tested positive for a breast cancer or ovarian cancer gene, we need to start for the screening of this cancer by mammography, which we start around 18 years of age, because breast cancers usually do not develop before that age. So around 18 years of age, we start with the screening, which is done by a very simple test that is called a mammography, which is done annually in a patient. And then we know that if there's something suspicious, we can very early detect the cancer and we can treat effectively and efficiently. So and the second thing is that the treatments also vary with the type of cancer. So if a breast cancer is caused by some type of particular mutations, we have some particular drugs, the medicines for which will be acting on that particular genetic mutations, which can stop the cancer, and they can treat, because these types of hereditary cancers, they usually do not respond to the usual treatment. Then for example, if a person is tested positive for a colon cancer gene is present in that person, so we know that this person might or might not develop the colon cancer. We know that there is a risk that the person can develop the cancer, and so we need to start the colonoscopy. So colonoscopy is just a simple test which is started around 20 years of age, and this is done at 2 yearly intervals. So and the third very common type of cancer is hereditary cancer is retinoblastoma. So if a child, because this usually occurs in children less than 7 years of age, so if a child has tested positive for a type of retinoblastoma gene which is inherited from a parent, we know that this parent has also a risk of passing on the same gene to their future children. So we can do the testing in utero, and even before the child is born, that the next child is going to have this gene and the cancer or not. So the genetic testing is really important. So any person who has a family history of cancers which are refractory to the treatment, which keep on relapsing, and there is a risk, or there's a family history of cancers present in multiple family members, or different types of cancers in family members, then we all need to get the testing done. Thank you very much. हो गया, फिर उसको कट कर लोगे पीछे से?